Hello, 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 and welcome everybody. Welcome to week 2 of the 16-week YouTube course. How are you? If you don't know already, I'm Mrs. J. I'm the curriculum developer here at AMCI, and I want to say hello. And I also want to say hello to my team. In the chat, you'll see the blue badges. Those are our interns. They're easy to determine. They're easy to see because they have a badge. However, the AMCI instructors, well, they have their images. Please say hello. Instructors and interns, please say hello to the AMCI YouTube course self-studiers. We are happy you are here. And we're going to get started with some housekeeping. Over the past week, our student success portal has answered a number of questions, and these are the most common questions asked. So they were important. So I felt that this is the best place to answer them because you could likely have these same questions. Number 1, do I have to join the Discord? Number 2, when will Discord become available? 3, how do I gain access to Discord? 4, what is the difference between the gold, silver, and bronze memberships? 5, will I earn a certificate of completion? 6, how do I log into my course? 7, where can I ask questions? 8, will the course be available after the 16 weeks? And 9, may I move ahead of the class? Okay, let's begin with the first question. Do I need to become a member or join the YouTube channel? The answer is no. No, you'll need it if you want to join the Discord. And we'll talk about the advantages of the Discord, but no, you do not need it. Also, if you want to join, just click on join from the YouTube channel, and it's next to the subscribe button. All right, next question. When will Discord become available? It will become available today, officially, after this session. Number 2, how do I gain access to the Discord? We will show you at the end of class. And 3, what is the difference between the gold, silver, and bronze memberships? What's the difference? Well, we're going to show you. Let's show you now. On site, you can see that there are more according to the tier. All right, so all of them get 2025 YouTube course extra help, extra resources, extra practice exercises, etc. They can communicate with other students and they can view private lectures. Silver, they get their questions answered by AMCI co-lead instructors, and they get CPC and CCS-P exam preparation. You're going to need that after the 16 weeks. Gold gets all of that, plus instructors' notes, 2025 Chun notes. That's gold. Also, there will be Chun class lectures where they'll get to apply their Chun to practice. And they get their questions answered by AMCI lead instructors. So that is the difference between the 3. Will I earn a certificate of completion? Absolutely yes. But you have to have the MCG manual to do so, because in the MCG manual there are tests and you'll be directed to take these tests. However, at the end, there is a final exam link. Click on that exam link and take your exam. But that link is closed right now, and it will be open after week 16 of this course. Now, make sure that you use the same email address that you used to purchase your MCG manual to get a certificate of completion. All right, these certificates of completion will be personalized. All right. How do I log into my course? Well, You don't have a login. No, you're self-studying. But if you just want to have a location where to find everything, you can log on to the website www.amcicoding.com/YouTube course, or you can go to the Discord. It's up to you. But my suggestion is to follow the syllabus. Follow the syllabus and you've got the course. All right, where can I ask questions? All right, that's a good question. Number one, the best place is in the Discord because everyone can get or benefit from the answer. Number two, and this is just as good, post underneath the YouTube video. So if your question is pertinent to the video, post under that video. Any other questions? Discord is best. We cannot accommodate your questions at AMCI. There are just too many of you. So we're doing our best to answer the most common ones, and hopefully we're getting them. And also, too, on our website, we have a chat bot. You can ask your question there as well. Will the course be available after the 16 weeks? You better believe it. It will be available. Do not rush. If you fall behind and life gets in the way and you're a little busy, it's okay. The course will be here. May I move ahead of the class? I have an exam scheduled and I need to go, go, go. Well, unfortunately, the answer is no, not really. The assignments will officially appear on your syllabus on the day of class. Yeah, I'm a little early, but sometimes I'll be a little early, but you can look for them to appear on the day of class. The YouTube course follows a structured weekly schedule, and that means students can't move ahead of the class. And this ensures that all of us stay on track with the lessons, the discussions, that's important, and guided practice. And this structure allows us to manage and address your questions in an organized way. So, making sure that everyone receives clear, timely, and accurate responses, that is what we're striving for. So, this 16-week course is guided. After the 16 weeks, you can do what you like. Now, I do want to say you can do the readings ahead of time because they are put on your syllabus, but any additional resource will be available the day of class that week. All right, so week 2 should officially be available today. And this wasn't as common a question, but it was a question. What are the required texts? I think we need to emphasize we recommend ICD-10-CM. If you're testing in 2025, we recommend 2025 manuals, right? We also recommend Bucks step-by-step. If you can't afford 2025, any year between 2023 and 2025 is acceptable. Also, the MCG manual, 2024 or 2025 is acceptable. Also, your CPT, 2025, and your HCPCS Level 2, 2025. Oh, and a lot of people have been asking about this Optum. They say, hey, I've got the AAPC. Can I use it? Absolutely. We just recommend Optum if your end game is the CCS. If your end game, when I'm saying end game, that means that you plan on taking a professional coding certification first, then pursuing your CCS. Second, that's your end game. That's what we recommend because you'll only need to purchase one book. You don't need to buy both. All right. Also, so if you're just kind of being economical and you're just, buying them as you need them, you're going to need your ICD-10-CM, your Bucks, and your MCG manual for the first 8 weeks. Then for the actual exam, if you didn't know, These three are required. Your ICD-10-CM, CPT, and your HCPCS Level 2. We recommend the current year manual. If you are taking the CCS-P by AHIMA, AHIMA has strict requirements. We'll put those requirements in your resources so you can look at them. But when you get closer to the exam, we'll tell you what you need. Now, we've gotten all that out of the way. I do want to tell you that we do have a disclaimer. Yes, if you are brand new to medical coding, this might not be for you unless you have watched the beginning lectures. That, or you've been in a course already, or we have a free I2MC Introduction to Medical Coding course. You can take that. But we're going to move at a pace that may be a little fast if you are brand new. If you're brand new, this may not be for you. Make sure that you go to the website, read the prerequisites. Okay, now AMCI copyright and trademark notice. CPT is copyright of 2025 AMA. All rights are reserved. AMCI trademarks, keyword concept, FTR, CHUN, AMCI Fab 7, AMCI ICD-10-CM Flip Tap, and MCG are registered trademarks of AMCI. The following credentials are owned by AAPC, CPC, CRC, COC, CPMA, CPB, CPPM, CPCO, and the following credentials are owned by AHIMA, CCA, CCS, CCS-P, RHIA, RHIT, and AMCI does not own the rights to these credentials. This week begins our study of ICD-10-CM specific coding guidelines, and we will focus on infectious diseases. This is chapter 1 if you're following along. And this is what you should already know. You should know ICD-10-CM section 1 guidelines called conventions, and those are A guidelines. You should also know ICD-10-CM Section 1 guidelines, and these are B guidelines, and they are general coding guidelines. You should also know first listed code selection, and that's found in Section 4. Those are Section 4 guidelines. And today, we're going to tackle ICD-10-CM Section 1C guidelines, and C are for specific codes, specific diseases. I just want to slip this in here. All right, so this is how you read a guideline. That first character, that's the section 1, right? The second is the type of guideline it is. Remember, A is a convention, B is a general coding guideline, C is a specific coding guideline. The 1 is the chapter. This is chapter 1, which is infectious diseases. A, that is the category within the chapter. So the category A is HIV, and they all have their own letter. So B is infectious diseases, C is infections resistant to antibiotics, D is sepsis, E is Mersa, F is Zika, and G is COVID. And beyond this letter is basically how the disease topic is organized. So I just wanted to just give you that background. We want you to know the study approach, how we recommend that you study these guidelines. Number 1, read the official guidelines. Number 2, remember. No, you don't have to remember any guideline. You just have to remember that a guideline classification of a disease, illness, or injury has a guideline. So you might say, Mrs. J, what are you talking about? Well, just know there are 22 chapters of guidelines. And each chapter focuses on a body system or body area, mainly system. So you're going to come to learn that Chapter 1 deals with infectious diseases. And you're going to also learn that there are about 5 classifications of diseases in infectious diseases, or Chapter 1. You're just going to know that HIV, sepsis, COVID, Zika, and Mersa, those 5 have guidelines attached. And so that's what we mean by remember. And if you don't remember or can't, the AMCI TAP annotation technique will help you. This is the annotation technique designed to help you remember during an exam that there is a guideline associated or attached to a specific disease, illness, or injury. All right. And there are various places that you can study the guidelines. You can study from the CMS publication. This is the link that you'll see on your syllabus, and it's also in the chat. You can also study the guidelines comprehensively from your index of your ICD-10-CM manual, as well as the tabular list of your ICD-10-CM manual. And finally, the MCG manual. A lot of our students choose the MCG manual because the sequencing order can be studied very quickly. And I want to take you into the MCG manual just to kind of show you. So if you go to HIV/AIDS, and I am aware that this tab, HIV/AIDS, might not be on your screen, or in your ebook, but it is being repaired. So for now, just go on to click on Chapter 1, Certain Infectious Diseases, and then scroll down until you see HIV/AIDS. And there you are. This third column here is what a lot of students like to reference. And then some students like to read everything. So they'll go into the middle and read. And this information is actually taken from the CMS publication. In fact, all publications base their publishings on the CMS, the original document, the link that I put in the chat for you, and it's also on your syllabus. So we all use the CMS official guidelines because that is it. And then for those who prefer or need clarification, there's some clarification and an example. But this third column is what sets the MCG apart from the others because it tells you how to sequence it really quickly. The exam is very fast, and therefore you're going to need to study these and know some of them. You don't have to remember all of them, but some of them. And this is a quick way to study. Now, some of you might say, well, you can't take this MCG to the test. Indeed, you cannot. My keywords is this is a study guide. And when you learn to tap, you're going to take the information from this MCG manual and tap it into your ICD-10-CM manual. And you might say, well, you already have the guidelines in the manual. You do. But again, this sequencing order is gold. It is for a lot of students. So think of this as the training wheels, right? You use it until you don't need it. Now let's begin our instruction with the goals of the presentation. Number 1, we're going to talk about ICD-10-CM guidelines for HIV, for sepsis, Mersa, COVID-19, and Zika virus. And we're going to begin with HIV/AIDS. Let's begin by defining what HIV is. What is HIV? This is human immunodeficiency virus. It's a virus that attacks your immune system, specifically the CD4 cells, and those CD4 cells are the ones that fight infection and diseases. And if you have HIV, it's hard to do so. And if HIV is left untreated, it can progress to AIDS, acquired immunodeficiency syndrome. Now, let's take a look at the symptoms or clinical indicators of acute HIV: fever, chills, headache, night sweat, sore throat, muscle aches and pains, joint pain, fatigue, swollen lymph nodes mainly in the neck, and mouth ulcers. Now, these are indicators, clinical indicators of HIV, and also I don't want you to confuse these clinical indicators or symptoms of acute HIV with HIV-related conditions. All right, so we'll put that on the back burner. And now let's go ahead and learn about our first guideline. Now we're going to just study a few key guidelines. We can't do them all, but let's go ahead and let's review the first. This is the first guideline about HIV that you will encounter, and it directs you to code only confirmed cases. Now, I'm going to pin guideline IC1A1 from the MCG manual, and this is guideline IC1A1, human immunodeficiency virus, HIV infections, code only confirmed cases. Again, this is CMS's original guidance, and code only confirmed cases of HIV infection illness. This is an exception to the hospital inpatient guidelines, section 2H. If you are studying for your CCS, this is significant to you because when you study principal code selection, you will learn that you may code unconfirmed cases of a disease or illness. All right, so I'm not digressing and I'm not teaching you that. This is only for CCS students, and they are already aware that you code for unconfirmed things in selecting the principal code selection, and that's for inpatient. So this guideline is an exception to that rule, and this guideline will take precedence. Okay, everybody else. Now, in this context, confirmation of HIV doesn't necessarily have to come from a serology test, right? So the doctor can just say, hey, this patient has HIV, AIDS, and it is so. And once HIV/AIDS has been documented by a provider, always will that patient have HIV/AIDS, and no other HIV-related code can be assigned. When we say HIV-related code, I'm not talking about diseases, HIV-related conditions. I'm talking about the codes that we are getting ready to study. So like HIV, asymptomatic HIV, etc. Now, here are the basic things that you need to remember. Number one, code only confirmed HIV, right? So if it's not confirmed, you're going to code the signs and symptoms, and you are not going to use B20 for unconfirmed cases. And number three, once a patient is B20, always that patient will be B20, even when the symptoms have resolved. All right, coders. Now, let's move on to another guideline. When the admission is for an HIV-related condition. you're going to use guideline 1C1A2A. And just so you know, an HIV-related condition is any disease, infection, or complication that occurs due to a weakened immune system caused by HIV, such as Kaposi sarcoma, Pneumocystis pneumonia, or HIV-related encephalopathy like here. So these are all HIV-related conditions, and they are caused by HIV. Now, here are the guidelines. But let's look first in column 1. We've listed common HIV-related conditions. So if you're coding a scenario and one of your conditions here appears, then likely it's an HIV-related condition, and you'll need to sequence in the following way. When a patient's admitted for an HIV-related condition, you're going to code first B20. And second, you're going to code that HIV-related condition, right? And remember, B20 is always coded with the HIV condition, not Z21, because it's implied that you are no longer without symptoms, right? In order to have an HIV-related condition, you have to have some symptoms. And finally, number 3, this is really big. Note, HIV does not need to be explicitly stated in the patient documentation, but it must still be coded due to the presence of HIV-related condition, right? So use B20 even when HIV is not documented, all right? So if an HIV-related condition is documented, you'll need to use B20. Oh, and there's one more thing. You're going to, if a patient's admitted for an HIV-related condition, you sequence first B20 followed by the HIV-related condition, except the exclusion is if the reason for the encounter is that hemolytic uremic syndrome that's associated with HIV, then you'll sequence that first, D59.31, followed by your B20. Okay, coders, I hope you got that. Now we have another HIV-related or unrelated condition. But what if the encounter is not related to HIV? Well, this guideline, IC1A2B, says when the admission is not for an HIV-related condition, you will sequence first the reason for the encounter. Let's say this gentleman here has a broken leg and he happens to have HIV. If he goes to the emergency and gets treated for that broken leg or ankle, looks like ankle, then the reason for the encounter will be sequenced first. All right? So you're going to sequence first the reason for the encounter. So if it's for the broken leg, then the broken leg will go first. Second will be your HIV code, HIV or B20 or Z21, the type of HIV that the patient has. And third, if a patient has an HIV-related condition, you'll sequence that third. And if the patient has an HIV-related condition, that second code will definitely not be Z21 because you cannot be asymptomatic when you have an HIV-related condition because that's clearly symptoms. I hope you're following me. All right, coders, I want to take a pause and I want to ask, how are you doing? How are you doing, coders? Let me know. Go ahead and type in the chat. Are you following these guidelines? All right, let's continue. What if a patient has HIV in pregnancy, childbirth, and the puerperium? If that is the case, then we're going to go to the guideline IC1A2G, and we're going to look in that third column and we're going to see how to reference it. But before we do that, let's look at the first column because we've placed the trimesters here. So if the patient's in the first trimester, that's less than 14 weeks, 0 days, that's first. If they're in their second trimester, they're between 14 weeks, 0 days to less than 28 weeks, 0 days. And third trimester, that's 28 weeks, 0 days until delivery. So you're going to need to know how to calculate the trimester because often it will be the fourth sequenced code. All right, what do you do if the patient is being seen for pregnancy and they also have HIV? That's considered a pregnancy-related complication, and we will do the following. We're going to sequence first that O code, 098.7. Let me get my pointer. We're going to sequence that O code first because Chapter 15 codes always have sequencing priority. That is a rule. That is an ICD-10-CM rule. So just know if that patient is pregnancy with HIV, you're going to sequence the O code first. Number 2, you will sequence that B20 or Z21, whichever is applicable. If they have no symptoms, they are asymptomatic and it's Z21. If they have symptoms, it's B20. And third, if they have an HIV-related condition or illness as well, you're going to sequence it too. And if you don't know, check the MCG manual. Remember, I had those common HIV-related illnesses, or check your ICD-10-CM manual. I know for a fact that the Optum have the HIV-related condition indicators. They're gray. All right? That's how you code when there's HIV in pregnancy, childbirth, and the puerperium. Let's review another guideline. What if a patient just went to get an HIV screening test? Oh, by the way, that image is a HIPAA violation. Free HIV testing if they call your name if you're in that facility. Yeah, they're linking the patient with their health status. Just saying, it's potentially. All right, so if they're going in for HIV screening, IC1A2H guideline is what we're going to follow, and they pretty much say that you will sequence Z11.4 and also any associated high-risk behaviors, if applicable, will be sequenced second. Now, if you want to know any common HIV-related high-risk factors, you'll see it in column 1, unprotected sex, multiple sex partners, injection drug usage, blood transfusions before screening, perinatal transmission, men having sex with men. These are common HIV-related high-risk factors. And again, this is how you sequence. You're going to sequence Z11.4. That will be first. And that's the encounter. That's an encounter code for HIV screening. And second, any high-risk behaviors. And third, if this patient is confirmed HIV positive, if during that encounter it's confirmed, you do not code those signs and symptoms. You just code B20 or Z21, and you disregard 1 and 2. Okay, coders, as you can see, these are not all of the guidelines, but hopefully you'll come to learn that these are some of the key guidelines that you can expect to know when you're taking your medical coding exams. Now, this is how you can study on your own. If you have the MCG manual, you can study on your own, the guidelines. If you have any guidelines, this is how you can do it. Hey coders, how are you? Are you ready to test your knowledge of HIV guidelines? Okay, let's do it. You've got this. Before I go on, I want to review how to solve an ICD-10-CM scenario the AMCI way. Number 1, inventory. Number 2, select your first listed code. Number 3, apply guidelines. And trust the guidelines. Coders, if it's in the guideline, just know that it is true and you have to follow it. These guidelines are not subjective, not at this juncture, not at this level. Now, when you go and you move on into the real world, they are, but for this exam, the guidelines in this context will rule. Now, if this is the first time you're seeing this AMCI way to solve a scenario, that means you did not attend last time or you didn't watch the playback. Make sure you watch week 1. Okay, coders, let's get started. What is the correct code for this encounter? A, Z11.4, B, Z71.7, C, R75D, Z21. A 30-year-old patient presents for a routine annual physical examination. During the visit, the patient requests an HIV screening test as part of their preventive health care. The physician orders the test, documenting that the patient has no signs, symptoms, or history of HIV or related conditions. Okay, coders, what is the correct code for this encounter? Your time begins now. All right. How did you do, coders? Okay. So I'm going to highlight. Because, we're just kind of getting our bearings, and I want you to see how I'm documenting. Well, number 1, there was a routine physical exam. Number 2, HIV screening test was carried out, and there are no signs and symptoms. And our instruction was to assign the correct code for this encounter. We're not told to sequence anything first, second, but which HIV code is appropriate for this encounter. Now, what we will do first is we're going to look at our inventory. We have a routine exam, HIV screening, and no signs and symptoms. So we are going to have to determine which guideline is applicable. And we have determined that guideline IC1A2A is the most applicable. And this guideline says, hey, when you have HIV tests, you're going to sequence first Z11.4 and any associated high-risk behaviors. There's no mention of any high-risk behaviors, but let's go ahead and do our due diligence. We see that A is Z11.4, but let's confirm it. If we look up R75, this is the HIV code for inconclusive laboratory evidence of HIV. There is no mention that there was inconclusive evidence, so therefore we're going to get rid of C. Next, Z21. Almost have that committed to memory. This is the code for asymptomatic human immunodeficiency virus or HIV infection. And we have come to learn that this means this patient, if this code is to be used, this patient has to have HIV diagnosis, but no symptoms. There is no mention that the patient has HIV. Patient just had a test, right? Okay, so the next code we want to look up is Z71.7. This is the code for HIV virus counseling. So it doesn't mean the patient has HIV, but it means that the patient was counseled. There's no mention of counseling. So we are going to eliminate Z71.7 and the code Z11.4 is our answer. So if you said A, outstanding. Okay. That one was pretty straightforward. Now let's move on to the next one. Of the following answers, which best describes the encounter? A, B20, J18.9, B, Z21, J18.9, C, B20, B59, and D, J18.9, B20. A 45-year-old patient is admitted to the hospital with complaints of persistent cough, shortness of breath, and fever. The provider performs diagnostic testing and confirms that the patient has Pneumocystis pneumonia. Okay, of the following answers, which best describes the encounter? You have 2 minutes. Your clock has already begun. Your time has already started. How did you do, coders? Well, hopefully you did this. You highlighted your key terms: persistent cough, shortness of breath, fever, and diagnostic testing confirmed Pneumocystis pneumonia. Is this your inventory list? Is it similar? Good. And when you are documenting your inventory, try and go in order just to kind of keep track. That's just a little tip. All right, my inventory is bottom left, and the guideline that I'm going to use is guideline 1C1A2A. And this guideline is when patient is admitted for an HIV-related condition, this is what you do. But also in the first column, we have common related HIV related conditions. And this is pretty much what I will reference generally if I want to determine if a patient has an HIV related condition. We have cryptococcal meningitis, cytomegalovirus or disease, Kaposi sarcoma, lymphoma, Pneumocystis carinii pneumonia or PCP, thrush, toxoplasmosis, tuberculosis. So these are general, right? So we couldn't possibly know all of the HIV related conditions, right? No, but I'm going to show you something. But let's go ahead and visit this guideline. When a patient is admitted for an HIV related condition, you're going to sequence first that B20, second, the HIV related condition. And then there is an exception. Let's read it. If the reason for the admission is a hemolytic uremic syndrome associated with HIV, you're going to sequence D59.31 first. And also, there is a note. This note is key. It says, HIV does not need to be explicitly stated in the patient documentation, but it must still be coded due to the presence of an HIV-related condition. All right, so on site, we can eliminate a couple of things, right, coders? Or no, one thing or two things. You can eliminate B and D because they are not sequencing B21st. Just saying. I'm going to let that marinate. Now, let's look up our codes. We have J18.9, pneumonia, unspecified organism. And we also have remaining B59. This is pneumocystosis. And then when you look under and you see the supplemental language, it says pneumonia due to Pneumocystis carinii in Jarovecki or Eurovecki. So this is indeed our code, Pneumocystis pneumonia. Now, why isn't J18.9 pneumonia unspecified organism correct? If you said, because you use that code when the organism has not been specified, and our organism has been specified, our organism is Pneumocystis. Also, you see that HIV indicator? Earlier I said they were gray, but as you can see, they're black. This is the Optum book. There are these HIV indicators, which I love. So you really don't need to remember these common HIV-related conditions because they are indicated for you. So with that said, because the pneumonia, unspecified, is not specific, we're going to eliminate all the J18.9s. So that eliminates A, B, and D. And C is our answer. Okay, coders, how did you do? All right, so if you got that correct, outstanding. But if you learned something, that is priceless. And that means the reason why I say it's priceless is because you're going to remember that. All right, let's move on. This will be our final scenario for HIV, and then we're going to move on to sepsis. All right, how should the coder sequence the HIV diagnosis? A, assign Z21 as the secondary diagnosis. B, assign B20 as the secondary diagnosis. C, assign Z21 as the principal. D, assign B20 as the principal. E, assign B59 as the principal. A 38-year-old patient with a documented history of HIV-related conditions is admitted to the hospital for an acute appendicitis, requiring emergency appendectomy. The patient is not receiving treatment for HIV during this hospitalization. The provider notes that the patient is asymptomatic at the time of discharge. Okay, coders, how should the coders sequence the HIV diagnosis? Your time has begun and you have 2 minutes. Okay, coders, this was a little tricky. This was trickier than I thought, right? All right, so let's go ahead and highlight our key terms. They are history of HIV-related conditions, admitted with acute appendicitis, had an emergency appendectomy, and the patient was asymptomatic at discharge. All right, what say you? Okay, let's see what the answer is. So, I needed a few guidelines to help me solve this scenario. The first guideline was IC1A1, and I want to point out that this is Roman numeral 1, but I do tend to say I'm old school, so 1C1A1 or IC1A1. And the guideline says specifically, once B20, always B20. Once it's assigned, the coder may never use any other HIV-related condition. Now, why would I need to reference this guideline? Well, because this patient has a history of HIV-related conditions. So that means the patient had a history of symptoms, and that means that patient was that patient could not be asymptomatic or without symptoms. And when you code HIV-related condition, you have to assign B20, as we've learned. So that means if we're looking at our answers, we can eliminate the asymptomatic codes found at A and C because the patient was B20 at some point. Are you with me, coders? Talk to me in the chat. Let me know. Or if you had an aha, you can say that too. All right, now I need another guideline to help me. And guideline IC1A2A, this is the guideline for when a patient has an HIV-related condition. Yeah, I just said that when they have an HIV-related condition, you have to sequence B20 first, followed by that HIV-related condition. Well, this isn't our case, right? Our documentation says the patient has a history of HIV-related conditions. So it's not our case, but if it were our case, E would be wrong because you never assign the HIV-related condition before a B20. So we're going to get rid of U. And that leaves us with B and D. And I need another guideline. Guideline 1C, 1A, 2B. And this guideline is when the admission is not for an HIV-related condition. Yes, so we learned that when it's not for the HIV-related condition, you're going to sequence the reason for the encounter first, that non-HIV related condition, and it happens to be acute appendicitis. That's going to be sequenced first. And therefore, B20 could not be sequenced before the acute appendicitis. No. So D would have to be incorrect because you can't assign it as principal. And that leaves us with B. You would assign your HIV code as secondary because it's not the reason for the encounter. Okay, coders, if you said B, outstanding. How do you feel, coders? Did you notice that you didn't have to look up some of the codes? Because the sequencing order actually gives away the code selection, especially if it's a multiple choice exam. Once you know or understand how certain things, not everything, are sequenced, you're doing pretty good. And remember, you don't have to remember all of the guidelines. You don't. You just have to remember the diseases that have guidelines attached to them. So we know in the infectious diseases section, you got HIV. All right, coders, now it's your turn. It's your turn to study the guidelines on your own. So, for homework, make sure that you do. If you have the MCG manual, go ahead and study them. You don't have to study hard, but put your eyes on all of the HIV guidelines. There's about 12 of them, and you're good. Now, we're ready to move on to sepsis. Let's begin by defining what sepsis is. It's a life-threatening condition that happens when your body's response to an infection goes into overdrive, and that causes widespread inflammation throughout the body, and it can quickly lead to organ failure. And some of the indicators, clinical indicators or signs and symptoms are a fast heart rate, low blood pressure, fever or hypothermia, shaking or chills, warm or clammy, sweating skin, confusion or disorientation, shortness of breath, sepsis rash, extreme pain or discomfort. And coding for sepsis has several nuances, so it's important that you focus on the guidelines, and we will review some of the key guidelines. But I want to talk about how sepsis progresses, how it progresses, because that can affect how you code as well. So knowing how it progresses may help. So let's review. Caught early, if those indicators that we just described are caught early, then often it's the stage before sepsis, and that stage is SIRS, Systemic Inflammatory Response Syndrome. And the indicators that you see here they mirror the indicators that we've just described. If a patient has temperature higher than 30 degrees Celsius or lower than 36, this is fever, this is hypothermia. Heart rate of 90 beats per minute or greater than. If the respiratory rate is greater than 20 per minute, that's tachypnea. And then if the WBC white blood count is greater than 12,000 cubic centimeters or 12 milliliters, or less than 4 milliliters or 4 cubic centimeters, or greater than 10% bands. And when you're talking about bands, you're talking about the type of white blood cell that helps fight infection. So this person's body is working, trying to fight off this infection. If unsuccessful, it progresses to sepsis. So sepsis is SIRS with a presumed or confirmed infectious process. Then sepsis can evolve to severe sepsis when the sepsis is accompanied with organ failure or accompanied by organ failure. And then septic shock is the organ failure with a refractory hypotension. So that blood pressure is decreased. Now, let's go ahead and define this sepsis, severe sepsis, and septic shock. Sepsis is a life-threatening condition caused by a confirmed or suspected infection that triggers an extreme immune response, leading to widespread inflammation and organ dysfunction throughout the body. Severe sepsis? Well, that's sepsis with an associated acute organ dysfunction. And septic shock? Well, this is the most dangerous stage of sepsis. This is where the blood pressure remains dangerously low despite fluids, leading to poor oxygen delivery and multi-organ dysfunction or MOD, and possibly death if not treated immediately. And I know personally how septic shock and severe sepsis, how dangerous these conditions are. All right, now let's code sepsis. How to code sepsis. To code sepsis, you'll need guideline Roman numeral 1, C1, D1, A. And this guideline tells you that you're going to sequence first. We're going to go over here in this third column, the systemic infection or causal organism. If there is no sepsis code for the systemic infection or causal organism, then you'll code A41.9. That's a general code, and it's here, right down below. So it's a sepsis unspecified organism, all right? So if the doctor doesn't specify the organism, use A41.9. And finally, when coding for sepsis, do not use a code from R65.2 subcategory. Don't. Unless there's an organ dysfunction. Got it? All right, let's move on and let's learn how to code for severe sepsis. To code severe sepsis, you'll need guideline 1C1D1AIII from the MCG manual. Yes, these are MCG clippings. We're going to look at the third column, and sepsis with organ dysfunction. You're going to sequence first that underlying systemic infection code. It's a sepsis code. If there is no specific infection code, then use the non-specific A41.9. That sequence first, and it looks like this: sepsis unspecified organism. Second, you're going to sequence your severe sepsis code, and that's R65.20. Remember, this severe sepsis code may never be sequenced first, and you can find it here. This is severe sepsis without septic shock. That's severe sepsis. And finally, you're going to code any associated organ dysfunction. And just so you know, sepsis with an organ dysfunction documented, an associated organ dysfunction documented, that's automatically severe sepsis. So if your documentation says the patient has sepsis and then lists within that documentation that the patient also has an organ dysfunction, and that organ dysfunction is related to that sepsis or caused by that sepsis, then it becomes severe sepsis. Now, let's take a look at some potential organ dysfunctions that you could see within documentation. The common organ dysfunctions that you'll see in documentation when you have sepsis are cardiovascular organ dysfunctions, hepatic system organ dysfunctions, that's your liver, renal system dysfunction. This is probably the most common that I see, and those are your kidneys. Neurological system, often it's the brain, but it could be the spinal cord too. Also, respiratory system and hematologic system, the blood. These are often documented along with sepsis, and anytime they are, it gets bumped up to severe sepsis. Now, let's review septic shock. To code septic shock, we're going to reference guideline IC1D2 and putting my MCG clipping, coding septic shock. This is how we will sequence. First, that specific or underlying systemic infection code. If we don't have it, we'll use the non-specific sepsis code A41.9. Second, we're going to sequence R65.21 or T81.12 from that subcategory code. Now we know R65.21 is severe sepsis with septic shock. That is our code. But that T81.12, this is post-procedural shock. So the doctor has to kind of indicate that. And this is shock resulting from a procedure. Now, third, we're going to code the organ failure, the organ dysfunction. Now, there are some things to remember. Always list your systemic infection first, or that non-specific sepsis code. And your septic shock is R65.21 or T81.12, and never sequence these first. And your organ dysfunction, a patient can have more than one for septic shock, so make sure that you list them. And that organ dysfunction has to be related, associated organ dysfunction. Now, all right, so we got some key guidelines down. So I think you're ready to solve some scenarios. And we have a bit of a surprise because Miss Bianca is going to present. Now, I want to let you know that some of her scenarios may not be the same guidelines that we reviewed. So it's going to be up to you to search the guideline really quickly and go ahead and solve it. You can do it, coders. Remember how to solve an ICD-10-CM scenario the AMCI way. You're going to inventory, select first listed, then apply all guidelines. Guidelines are key. Okay, Miss Bianca, take it away.
My pleasure, Miss J. Which of the following codes should be assigned? A. R65.20, B. A41.9, C. T81.44XA, D. R65.21. A 65-year-old patient is admitted to the emergency department with a fever of 102 degrees, rapid breathing, 22 breaths per minute, elevated heart rate, 110 beats per minute, and confusion. Blood tests reveal an elevated white blood cell count and high levels of C-reactive protein. After evaluation, the physician diagnoses sepsis, but the underlying cause or organism is not specified. You have 60 seconds to solve, and your time begins now. All right, so now let's go over our inventory list. So I put fever, rapid breathing, elevated heart rate, confusion, and sepsis. And so I put our little inventory list down there on the bottom. And now let's work on solving. So the guideline that we used to solve this scenario was Chapter 1, D1A. I have my inventory list over here in the bottom left, and I'm going to eliminate just a couple things to make it a little bit easier for us for coding. So I'll eliminate fever, rapid breathing, elevated heart rate, confusion, and we're only going to leave sepsis because that's what we're going to be coding for in this scenario. And so I do want to bring up this guideline here regarding the signs and symptoms of the exclusion rule more specifically here on the bottom right. It says, do not assign additional codes for signs and symptoms routinely associated with disease processes. So that is why I eliminated all those things on my inventory list because they are integral to the sepsis. So the actual guideline that I'm referencing, the D1A, is right here, and it says when you have sepsis, first you want to code the systemic infection or causal organism, or first you'll code A41.9 if the causal infection is unknown, kind of like in our case here. And it says do not use R6520 unless there is an organ dysfunction. So with that being said, we are going to eliminate A because that's the R6520 and D, the R6521. We can also, because the guideline tells us what to do, eliminate option C, T81.44XA, because this is telling us to code first the systemic infection or causal organism, which we don't know. We just know this person has sepsis. And so since we know they just have sepsis, the first code we'll list is the A41.9, which is the sepsis code. And so that leaves our answer as B, A41.9. So that one was just a little bit easier to get you guys' feet wet. And now let's move on to question number 2. Okay, Which of the following represents the correct sequence of ICD-10-CM codes? A, L03.115, A41.9, R65.20, B, A41.9, L03.115, R65.20, C, R65.20, A41.9, L03.115, or D, A41.9, R65.20, L03.115. A 65-year-old patient is admitted to the emergency department with fever of 102.2 Fahrenheit, tachycardia, heart rate of 110 beats per minute, hypotension, blood pressure of 85 over 50 megahertz. I can never remember how to say that. I've looked it up several times. And tachypnea, respiratory rate of 24 breaths per minute. The patient's right lower leg shows signs of redness, swelling, warmth to the touch, and is painful and tender. After examination and blood tests, the physician documents severe sepsis due to cellulitis of the right lower leg. You have 60 seconds to solve, and your time begins now. Okay, so we'll start with our inventory list, and I put on mine fever, tachycardia, hypotension, tachypnea, and severe sepsis due to cellulitis of the right lower leg. And I did also add this little image here to kind of show you some of the common symptoms associated with sepsis in case some of you were unfamiliar. And now the guideline that we chose to use to solve for this scenario is Chapter 1, D4, and I have my little inventory list right there. And our guideline states that if you have an admission with severe sepsis and a localized infection, you're going to code for the specific systemic infection or A41.9. And second, you're going to list the localized infection. Third, the category code R65.2 if present. And fourth, any associated organ dysfunction if present as well. So let's kind of refine our inventory list a little bit just to make it more manageable. So I'm going to get rid of fever, tachycardia, hypotension, and tachypnea because those are all integral to our severe sepsis due to the cellulitis. So now let's look at our codes here. As you can see, our options are fairly similar. They just have some different sequencing orders. So L03.11 category, more specifically the L03.115, is the cellulitis of the right lower limb. And that is the code that we are wanting to reference because up here we have the severe sepsis due to cellulitis of the right lower leg. So I'm going to eliminate options A, C, and D based off of sequencing order and our guideline over here to the right because it's telling us to code first for the systemic infection and then the localized infection here. So we just have severe sepsis as our infection. So we have A41.9, L03.115, which is the cellulitis of the right lower leg, and then the R65.20 to categorize the severe sepsis. Okay, So our answer is B. So hopefully you all got that correct. And if you didn't, I hope you all learned something. And let's move on to the next one.
How'd you do, coders? How was it? Did you have any takeaways? Was your understanding of sepsis guidelines reinforced or strengthened? Okay, coders, now it's your turn. Time to take your MCG or any method that you choose to study the guidelines and study those Chapter 1 infectious diseases sepsis guidelines. There are about 18 of them, so go ahead and do what you do. Also, there are some practice questions in the Discord folder under resources, about 20 questions. So thought I would let you know that. Now let's begin the next subject, MRSA. MRSA. What is MRSA? Well, MRSA is the acronym for Methicillin-resistant Staphylococcus aureus. It's a type of bacteria or staph infection that's resistant to many antibiotics, especially penicillin or psyllin, antibiotics in that family. And there's also a condition called MSSA. I call it MESA, and this is methicillin sensitive Staphylococcus aureus. So one of the difference between them, MRSA is resistant to treatment or antibiotics, and MSSA or MESA is susceptible. So actually antibiotics work for the MESA. Now let's go ahead and let's look at how it spreads and some indicators. Well, it's extremely contagious. Let's just put it that way. Contact is pretty much how it's direct contact is pretty much how it's spread. Now the indicators down below on the skin, it can be red, swollen, painful, warm to touch, full of pus or other liquid, and you could have a fever. So this is generally what MRSA and MSSA are. If you want a way to distinguish the two, MRSA with the R is for resistance to antibiotics, and MESA with the S, that means it's susceptible. That means it works, all right? And what type of antibiotics is MRSA resistant to? Those antibiotics in the penicillin, the methicillin family. Antibiotics like ampicillin, amoxicillin, oxacillin, nafcillin. You get the picture. Okay, let's go ahead and learn a few guidelines on how to code MRSA. Now, we're going to change things up just a little bit. You can find the guideline on the left side of the screen. Guideline 1C, 1E, 1B. This is the guideline when there is no available MRSA combination code. All right, coders, so just so you know, MRSA codes are combination codes. So typically it has the causal or it'll have the MRSA as well as the causal organism in that code. Now, this is what you do when you don't have a MRSA code. You're going to do the following. You're going to sequence the causal organism or infection first, followed by B95.62. This B95.62 is a general MRSA code and it doesn't include the causal organism. So you'll have to include the infection first, followed by that MRSA code. So the first thing you're going to do, sequence the causal organism, infection, or condition. Second, you're going to sequence that B95.62. And remember, oh, here is the code if you want an image or visual. B95.62, Methicillin-resistant Staphylococcus aureus infection as the cause of disease classified elsewhere. You don't know the bacteria or the organism is not included. And also remember, do not use Z16.11 resistance to penicillins when coding or using a Mersa code because it's implied, it's understood, right? So anything that has the term MRSA in it, methicillin-resistant Staphylococcus aureus, means that it's resistant to penicillins. All right, got another guideline. When a patient has MRSA or MESA colonization, you'll need to look at guideline 1C1E1C, and this guideline tells you that you'll need to sequence these encounter codes Z22.322 and Z22.321. So let's take a look. You're going to code first if the patient is admitted for MRSA colonization. That means that the patient has MRSA bacteria present on the skin and mucous membranes, but they don't have an active infection or symptoms. All right, so you're going to code Z22.322 if the patient has MRSA colonization, and you're going to code Z22.321 if the patient has MESA colonization. And always check the documentation for accurate code selection. You want to make sure that the patient indeed has colonization as opposed to the active infection. All right, I got another guideline. The final guideline that we're going to study is when a patient has, well, they're a MRSA carrier and or suspected carrier with the infection. Guideline IC1E1D. So if they're a suspected carrier or carrier, then they have that colonization. Yes. So what you're going to do, you're going to sequence first the code, the specific MRSA infection code, that combo code. Sequence that first. Now, if they don't have the combo code, then you're going to have to code first the location of that infection or the infection, and second, that B95.62 code. That's the non-specific MRSA code. And third, you have to code that colonization code, Z22.322. All right, coders, it's time. But first, let's review how to solve an AMCI ICD-10-CM scenario the AMCI way, just in case you forgot. Remember to inventory, select the first listed code, apply the guidelines, and trust those guidelines. Okay, Miss Bianca, take it away, please, and thank you.
Okay, coders, now let's start with our MRSA questions. So, which of the following code assignments is correct? A, A41.02, B95.62, B, A41.02, Z16.11, C, A41.02, D, A41.9, B95.62, Z16.11. A 68-year-old patient is admitted with fever, tachycardia, tachypnea, and confusion. Blood cultures grow MRSA, and the physician documents sepsis due to MRSA. You have 60 seconds to solve, and your time begins now. Okay, now let's do our inventory. We have fever, tachycardia, tachypnea, confusion, MRSA, and then sepsis due to MRSA. So the guideline that I chose to solve this was Chapter 1, E1A, and I have my little diagnosis, signs and symptoms, my inventory list down here in the bottom left, and I'm going to eliminate anything integral to that sepsis due to MRSA. Okay, so our guideline states that when you use a combination code when available. So if we have sepsis due to MRSA, we want to use the combination code if it is available. So in this particular one, it actually tells us that we will use A41.02 for sepsis due to MRSA. And there is also another code here for pneumonia due to MRSA as well. So we are coding sepsis due to MRSA. So let's take a look at the code options that we have here. I know the guideline already pretty much told us the answer, but let's still go through the process here and look at A41.9, which is sepsis unspecified organism. This isn't applicable to our specific situation because we have sepsis due to MRSA. So we are going to eliminate A41.9 and all the options that have that one listed, which is option D. And now let's look at A41.02, which is sepsis due to MRSA, which is very in line with what we have going on in our scenario. So we're going to keep this code and any options with this code in it. So moving along to B95.62, which is MRSA as the cause of the disease classified elsewhere. We're going to eliminate this option here because our A41.02 already encompasses the MRSA inside that code because it's a combination code. So it would be redundant to code this one. So we're going to get rid of this guy and all of the options left with him in it. So we're going to eliminate option A. And now we're going to look at Z16.11, which is resistance to penicillin, which is what MRSA is. So we are going to eliminate this guy as well and all of his options, which is option B, which leaves us with A41.02, option C as the answer. All right, coders, I hope that made sense to you and the guideline completely answered this one for us, but it's always good to go through all the code processes just to kind of see it work in case you missed the guideline or something on your exam. All right, let's move on to question number 2. Okay, MRSA question number 2. Which of the following code assignments is correct? A, J15.212, Z22.322, B, J18.9, T81.4XXA, B95.62, Z22.322, C, T81.4XXA, J18.9, B95.62, Z22.322, or D, J18.9, B95.62, Z22.322. A 60-year-old patient is admitted with pneumonia. During the hospital stay, the patient is found to have Mersa colonization in the nares and subsequently develops Mersa wound infection at a surgical site. You have 60 seconds to solve, and your time begins now. Okay, so let's get this inventory list, and I put admitted, pneumonia, MRSA colonization in the nares, and MRSA wound infection. Okay, so we have our inventory list down here in the bottom left, and I just took out the admitted portion and left the other three options as because they are applicable to our scenario. So the guideline we chose was Chapter 1, E1D, and this guideline, I just highlighted here the clarification for a patient with both MRSA colonization and infection during admission, assign both the Z22.322 322 carrier code and the appropriate MRSA infection code. And then further down, it'll actually give you some sequencing order examples for that here. And over here on the little column here to the right, it does say code first, the specific MRSA infection, second MRSA, and then third that carrier code. Okay, so based off of the guideline, I am going to eliminate A and D. And that's just leaving us with options B and C. And pretty much that's just going to be up to sequencing order here. And so now let's look at the codes. So we have J18 category, which is pneumonia unspecified. Always review your notes here. What we have up here isn't completely applicable to our scenario, but you still want to make sure you're reading them. And then scroll all the way down to J18.9. I had to cut it in half because it was just too much. And we have pneumonia, unspecified organism. And that is in alignment with our scenario here because we don't know which organism this person has with their pneumonia. So now let's look at T81.4, which is infection following a procedure. And once again, those notes are very important. The one I keyed in on was the use additional code to identify infection. So we are going to keep this guy, but as you can see, he has the fifth character red checkbox. So we need to go up to the extender box and take a look at that. And in here we have the initial encounter because this is the initial encounter. So we are going to tack on A to the end of this code here. Okay, B95.6 0.62 is the MRSA as the cause of a disease elsewhere classified, which is in line with our scenario because we do have that MRSA wound infection. So now let's look at Z22.322, which is that carrier code. We are going to keep this because as the guideline states, if you have both within the admission, we're going to code for both. So we did have the MRSA colonization in the NARES, and then we had the MRSA wound infection that happened later. So based off of this, our reason for our encounter was the pneumonia. So I am going to go with option B, J18.9, T81.4XXA, B95.62, and Z22.322. All right, coders, I hope you all got that correct. And if you didn't, it's okay. I hope you learned something from the guidelines there. And now let's move on to Zika.
Thank you, Miss Bianca. Okay, coders, how did you do? Was MRSA coding straightforward, or did you get tripped up on that guideline about selecting the combination code? All right, let me know. Type in the chat. Remember, I'm in the chat. I want to know. Okay, so when you see this screen, you know it's time for me to tell you that you need to study the guidelines. There are 4 guidelines on MRSA. So go ahead, flip to the infectious diseases pages and study just to make yourself familiar. Now we're going to move on to Zika. And what is Zika? Zika is a mosquito-borne flavivirus, primarily transmitted by a specific mosquito called the Aedes, causing mild symptoms such as rash, fever, conjunctivitis, and joint pain. However, it can lead to serious complications, including congenital Zika syndrome in newborns, and you can see the newborn on the right, and neurological disorders like Guillain-Barré syndrome in adults. You see that on the left. Now, there's only one guideline for Zika, and the guideline is that you must code confirmed cases only. Period. That's it. That's all you have to remember. Now, if it's suspected, probable, rule out, I'm talking to my inpatient coders, you do not code it. You code only confirmed. So if there's no Zika, you're going to code those signs and symptoms, and there is a encounter code for Zika. Encounter for suspected Zika. So that's it. Now, let's go ahead and test your knowledge. And don't forget, inventory, select the first listed, apply guidelines, and trust those guidelines. Okay, Miss Bianca, please and thank you.
Okay, let's do our first question for Zika. Which of the following code assignments is correct? A. A92.5, B. R50.9, R21, M25.50, M20.851, C. A92.5, Z20.821, or D. Z20.821, R50.9, R21, M25.50. A 35-year-old patient presents to the hospital with fever, rash, and joint pain after returning from a vacation in Brazil where he visited his girlfriend. His trip was cut short because his girlfriend had contracted Zika virus. He is seeking out care due to his intolerable symptoms. The physician documents exposure to and probable Zika virus infection in the patient's chart pending laboratory results. You have 60 seconds to solve, and your time begins now. Okay, now let's take a look at our inventory here. And I put fever, rash, and joint pain. And he is seeking out care due to intolerable symptoms, exposure, and probable Zika virus infection. So the guideline that I chose to use was Chapter 1, F1. And this guideline states that do not code A92.5 without a confirmed diagnosis. So we have our inventory list over here on the left, and I am only going to eliminate the probable Zika because it's not confirmed. So now let's take a look at all of these codes because they all are fairly similar, except for A. We're going to eliminate that one because that is the code for Zika and we don't have a confirmed case. So we are going to eliminate A and C, actually, and D. We're going to eliminate D here because it is sequencing the exposure code first. And this patient is seeking care due to his intolerable symptoms. So we are going to list the signs and symptoms first in this particular scenario, which leaves us with option B, R50.9, R21, and 25.50. All right, that one was a little bit easier. And so now let's move on to question 2. Okay, What are the correct ICD-10 CM codes for this encounter? A. A92.5, B. Z20.821, C. A92.5, R50.9, D. R50.9, Z20.821. A 32-year-old female patient presents to the emergency department with complaints of fever, rash, and joint pain for the past 2 days. She reports that she was recently on a trip to Florida where she was bitten by mosquitoes. There have been recent reports of Zika virus cases in the area. Laboratory testing confirms Zika virus infection, and the provider documents a confirmed diagnosis of Zika virus disease in the medical record. The patient is discharged home with supportive care and advised to follow up with her primary care physician. You have 60 seconds to solve, and your time begins now. Okay, coders. And I just saw this image here and thought it was interesting that a mother can transmit the Zika virus to her child, which can cause the microcephaly. So that was just a tidbit of information that I found. So for our inventory list, I put emergency department, fever, rash, and joint pain, bitten by mosquitoes, and confirm Zika virus infection. The guideline that I used to solve this scenario was Chapter 1, F1. I have my inventory list over in the bottom left-hand corner, and the only thing I'm really going to eliminate is the emergency department and the signs and symptoms and bitten by mosquitoes. So our guideline states that confirmed diagnosis, we are going to code first A92.5. So with that being said, we can eliminate all the other options, and that leaves us with option A, A92.5. All right, coders, now we're going to move on to COVID.
We finally made it. We are at COVID. Yes, COVID is the last set of guidelines for the infectious diseases, Chapter 1, ICD-10-CM. So let's get into it. And let's define what is COVID. COVID is a highly contagious respiratory illness caused by SARS-CoV-2 virus, and it was identified in the late 2019, and that led to a global pandemic. And that disease spreads through the respiratory droplets from coughs, sneezing, or close contact with infected individuals. And the common symptoms are fever, cough, shortness of breath, fatigue, loss of taste or smell. And as you all know, this was during our time. So we know people that have had symptoms. So, we know those symptoms can vary. Indeed. Now, it is believed that vaccination, masking, and proper hygiene played a crucial role in reducing the spread of COVID. And we have to study these guidelines. You know why? Because there are coding nuances associated with coding COVID. In fact, COVID has more guidelines than any of the other topics within the infectious diseases section. So let's get into it. And let's learn about coding Only confirmed conditions or cases of COVID-19 guidelines C1G1A says that you may only code confirmed cases and you will use U07.1. This is the code for confirmed cases of COVID. Now, here's an important do not. Do not use U07.1 for unconfirmed cases. That's kind of obvious, right? And do not code signs and symptoms when you have a positive diagnosis of COVID. Also, a provider's documentation alone is sufficient to code COVID. So if the doctor says the patient has COVID, then you code it. And a serology or antigen test is not required. Presumptive testing are classified as confirmed. So if the documentation says, hey, presumptive testing was positive, then it's confirmed. Alrighty, okay, you might not know what presumptive testing is. It's a little involved, but when we get to week, I believe 14, yeah, we're going to talk about presumptive tests. All right, so let's move on and let's talk about when COVID meets the definition of first listed. There are guidelines. Guideline C1G1B. When COVID-19 meets the definition of principal or first listed, it's kind of obvious, right? We're going to sequence COVID-19 first, U07.1. But second, we are going to sequence those manifestation codes. What are manifestations? The manifestations are caused by COVID, and often they are pneumonia, acute respiratory distress syndrome, bronchitis. So they're often respiratory infections. And finally, there are some exceptions, and you can see the exceptions documented. We have severe sepsis and septic shock. That's an exception to the sequencing rule. So too are the pregnancy, childbirth, and puerperium codes. Those Chapter 15 codes, remember, Chapter 15 codes take precedence. Newborn codes and lung transplants. These are all exceptions. Okay, coders. These are the guidelines when COVID-19 meets the definition of first listed. Our final guideline that we're going to review is post-COVID-19 conditions or sequelas. Yes, COVID can produce a residual effect. In other words, a sequela. Guideline 1C1G1M. And when a patient has a residual effect from COVID, meaning after COVID, they had another condition, then you use this guideline. You're going to sequence first that resulting condition or that sequela. Next, you're going to sequence U09.9. This is your post COVID-19 condition unspecified. All right. And I want to tell you that the way to distinguish if it is related to a previous COVID, carefully read the documentation. And if you look here, it says code U09.9 should not be assigned for manifestations of an active COVID-19 infection. So you don't use U09.9 for a current one. So you don't use U09.9 with typically the COVID code. However, if a person has a subsequent bout of COVID, You may need to, but you have to distinguish that this is due to the previous COVID. All right, so make sure you look for those keywords, sequela, post COVID, etc. Now, some examples of post COVID conditions. Of course, it can be, respiratory conditions, but it can literally be anything that the doctor documents. Um, Still cardiovascular, any part of the body system, even depression. So if the doctor says it's resulting from COVID, then it is a post COVID condition. All right. Okay, so I think that's it. Coders, how do you feel? Are you ready? Okay, so let's go ahead and test our knowledge. Remember, inventory. Select your first listed, apply your guidelines. All right, Miss Bianca, take it away.
Okay. Which of the following code assignments is correct? A. J12.82, U07.1, B. U07.1, J12.89, C. U07.1, J12.82, D. J12.82. A 70-year-old patient is admitted to the hospital with severe shortness of breath and fever. After examination and testing, the physician documents COVID-19 with viral pneumonia as the primary reason for admission. You have 60 seconds to solve, and your time begins now. Okay, let's do our inventory. So I have admitted severe shortness of breath and fever, COVID-19 with viral pneumonia. Okay, so the guideline that I chose to go with to help solve this scenario was guideline Chapter 1 G1CI. And this particular guideline states that if you have pneumonia due to COVID-19, you're going to sequence based off of the RFE. So you'll either have the COVID first or the pneumonia code first. So now I have my signs in my inventory list over here in the left corner, and we're going to eliminate anything integral to the COVID-19 with viral pneumonia. So that leaves us with just the COVID-19 with viral pneumonia. So now the U07.1 code I know is the COVID-19 code, so I didn't include a clipping of it here. So, but let's take a look at these J codes. We have J12.82 and J12.89. 82 is pneumonia due to coronavirus disease, which is very much in line with our scenario. And so we are going to keep that guy. And then we have J12.89, which is other viral pneumonia, which isn't very specific like ours is for COVID. So, and also under J12.82, you'll see you have your code first COVID-19 U07.1. So this will help you out as well if you miss the guideline. So, with that being said, I am pretty much going to eliminate everything except for option C, which is U07.1, J12.82. All right, now let's move on to question 2. Which of the following code assignments is correct? A, J20.8, U07.1, B, U07.1, J20.8, C, U07.1, J40, D, J20.9, U07.1. A 45-year-old patient is admitted with fever, persistent cough, and chest discomfort. After testing and examination, the physician documents COVID-19 with acute bronchitis in the patient's chart. You have 60 seconds to solve, and your time begins now. Okay, now let's do our inventory list. So I have fever, persistent cough, chest discomfort, and COVID-19 with acute bronchitis. So the guideline that I chose to help solve this scenario is Chapter 1, G1 CII. And this guideline states that if you have COVID-19 with acute bronchitis due to COVID-19, we are going to sequence according to the RFE. So you're either going to sequence the COVID first or the acute bronchitis first. So we have our inventory list over here, and we are going to eliminate any signs and symptoms that are integral to the COVID-19 with the acute bronchitis. All right, so let's look at our codes for the COVID-19 with acute bronchitis. So we have J20.8, which is acute bronchitis due to other specified organisms. And if you remember from the guideline, this was the specific code that they had mentioned. So we are going to keep this code. But let's take a look at the J20.9, which is acute bronchitis unspecified, not applicable to our situation because we have COVID-19 documented. So we are going to eliminate that and eliminate option D because it has that option listed. So we have moving on to J40, which is bronchitis not specified as acute or chronic, which once again isn't applicable to our situation since we have acute bronchitis listed. So we are going to eliminate J40 and any options there that is listed. So eliminating option C. Now we have our COVID-19 code, which is U07.1. We are going to keep this code, but I also want you guys to make sure you are looking at our notes because this will tell you use additional code to identify pneumonia or other manifestations such as, and it'll give you a list of different manifestations. So now options A and B is just based off of sequencing. So I'm going off of how the documentation is written. It's written COVID-19 with acute bronchitis. So I am going with option B, U07.1, J20.8. All right, coders, I hope you all enjoyed those scenarios and that you learned something. Please be kind to yourself. You will get fast in time if these were a little bit more of a challenge for you. Just keep practicing and review the instruction and remember to trust your guidelines. I will talk to you all soon. Bye.
Okay, coders. So you see my image of the MCG manual. This is my reminder to tell you. Oh, by the way, thank you so much, Miss Bianca. Okay, now it's my reminder to tell you that you should study these guidelines. And COVID's got about 25 guidelines. So take your time, look through them, and just make yourself familiar. All right, so I want to be clear. You don't have to remember them, just be familiar. Now, I think this is it. Now we're ready to talk about homework. So you go to the website. If you want the syllabus or anything, go to the website www.amcicoding.com. Click on YouTube course. We don't have an LMS, but we do have a web page. All right, click on it. Then click on the syllabus. There you go. And we are putting the link for the syllabus in the chat right now. So it's in the chat. If you want it, you can get it there, or you can just go to the website. Now let's review the homework for week 2. All right. First things first, number 1, download the PowerPoint handout. This PowerPoint handout should match this playback. And if you want to, you can follow along with the playback. Now, this is where you download it. However, we always will not have this playback handout, not here. So you have to go to the Discord to get it. Why? Because that's pretty significant. Someone can take that PowerPoint and reproduce it and reproduce your instruction. And we just don't want to give it to them. So go ahead, go to the Discord. If you want to follow along with the playback, you'll need to go to the Discord. We apologize, we can't. It's just, we're giving away a lot, and we just don't want to make it easy for people to duplicate this material. All right. So I don't want to give it to them. So if you want the handout, it will be available in Discord. All right. So let's watch the playback if you need to. Sometimes you don't. But if you do, it's here, and follow along with your handout. Number 3, read the official guidelines. It doesn't matter where you read it. You can read it, the official guidelines. There's a handout there where it says click here, and also you can see it in your index, in your tabular list, or the MCG. So 3 places. Number 4, read your MCG manual chapter guidelines. We do want you to put your eyes on it there because the sequencing order, you see how it's laid out. So it may be helpful. I think it is. All right. Number 5, your reading assignment. It's Carol Buck's Unit 2, Chapter 5. Read only infectious diseases. That's it. And it's not a lot. It's just a few pages. Only infectious diseases. And also complete the exercises. The exercises in the toolbox. Exercise 5.1 and 5.2. And note that the answers are located in Appendix B. Now, if the answers are not in Appendix B, you can find it on the link in your syllabus. We've placed the answer key there. Number 6, go ahead and watch the YouTube lectures. We have lectures broken down on HIV, sepsis, Mersa, and COVID. So it's in your playlist. Click the green link or hyperlink. Number 7, watch the MCG TAP lecture. TAP is the annotation technique for ICD-10-CM. So it's AMCI's technique, and it will show you how to place guidelines next to codes. Yes, and that sequencing order. it's basically going to show you how to put the guidelines where they need to be when you need them. So you you click on your book. If you have an ebook, click on log on, and then on the very first page or two, it says videos, charts, etc. Click on it. You'll see a QR code with a link underneath. Either you can click the link or snap the QR code, and you'll see these lectures. And these are really good because this is also instruction. So just click on it this is for HIV, sepsis, COVID, and then you're going into next week's right here. So click as you go, and just want to let you know that not these lectures per se, but if you see any lecture that may have an incorrect code or incorrect information, just respond on that, just post on that video and we'll see it. But before you post, look in the description to see if there's an errata. Okay, I digress. So, number 7, watch your MCG TAP lecture. This is the instruction to annotate your ICD-10 CM manual. Yes. All right. Number 8, we have some additional practice questions in Discord. It'll be in your resource. And speaking of Discord, we're going to show you in a moment. But the last thing, number 9, if you've purchased the Bucks optional workbook, we don't recommend it. It's not required. It could be overkill. But they do have some practice exercises. And if you're not in the Discord, do those practice exercises. Now, speaking of Discord, when you get your invitation, and you will get it today, you log into Discord. And I know a lot of people get overwhelmed because it's sensory overload, a lot of colors and things going on, or it's dark, either or. When you come in, you're going to land right here at the welcome. Read everything. And when you're finished, introduce yourself. And also, when you finish that, you'll navigate on the left. You can read any announcements that we have. If you want to chat with your peers, you can there. You can ask an instructor here, and those resources that I talked about, they're right here. And if you don't know, like when you click on something you don't know what to do, look up at the top. It will guide you. All right, that's it. Let me know in the chat if you have any questions. And this is where AMCI, the entire team, we want to say thank you to you. You didn't have to be here. You are here. You're showing up. You're doing the work. You are rocking that chat. Yes. All right. Good job, coders. Great job, everyone. Team, you are amazing. Just want to remind you that we do have a survey. If you can help us by completing that survey, it will help us help you. And I don't want to forget my team. Thank you, AMCI Amazing Team. You are the best. You were handling those questions in the chat as you always do. And I appreciate you. And remember, this journey won't always be easy, but you are capable. You are strong, and you are meant to succeed. All right, coders, stay committed, stay curious, and believe in yourself.
$4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI. We're on the East Coast, the West Coast. We're all around the world. AMCI. see.